Good afternoon and welcome. Today we celebrate the opening of the Yale New Haven Health and the Yale Medicine Orthopedic facility here on the beautiful Masonicare campus in Wallingford. My name is Brooke Spadaccino. I'm the Director for Orthopedic and Spine Services at Yale New Haven. I will be your MC for a short program to hear from some special guests. The first of our special guests is Dr. Churchwell, the President of Yale New Haven Hospital. Dr. Churchwell, you're looking dapper as always.
Thank you, Brooke. Well, good afternoon, everybody, and good evening. A few years ago, Yale New Haven Health decided to pursue a strategy to bring access to our healthcare services out of New Haven and into many of the communities that we serve. This strategy has made sense, and it still makes sense today, especially for the services that used to be available only at Yale New Haven Hospital. You probably know we're busy there at this particular point. And you have to pay for parking and all that. As part of that strategy, we have reorganized our leadership structure to facilitate planning, communication, and implementation with the necessary cross-functional input and resources that are necessary to transform a strategy into bricks and mortar. What in the world does that mean? And from where I come from, I'm from actually Tennessee, that would be described as highfalutin talk. We used that word when I was growing up. And what I was really trying to say is that we have asked all of you and all of our physician partners, all of us who work with us, what is needed here? How can we help? And what can we achieve? To realize our goal to bring services to this part of Connecticut, we have been fortunate to find a partner that shares our vision and our values. That partner is Masonicare. Jean Paul, who I've only met by Zoom, so now we're intimate friends. We have become acquainted in a unique time in our history as we work towards shared goals for our organizations. And you see, our original plan was to open this site in October of 2020. 2020. It seems so long ago. The coronavirus pandemic brought those plans to a rather abrupt halt. But the first services we brought to the Masonicare campus was COVID-19 testing. Still going, as you may have noticed, by the signs that got you to this building. Even as we continue into year 2 addressing problems unique to the pandemic, concurrently there is a tremendous amount of work being done by multiple teams to tackle unforeseen challenges and foreseen challenges such as patient volume, staffing, and access to services. One of those teams was comprised of all the folks involved in this project. Each of them are contributing in other roles as well, and I thank you. Some assigned to this project before the pandemic have been redeployed and others have stepped up. I want to acknowledge and thank every one of those individuals. As an academic health system, we are committed to not only the highest level of care, but also the most innovative. We are committed to delivering superior care and value each and every person we serve at this Masonicare facility. Yale Medicine and Yale New Haven Hospital have assembled a team of orthopedic specialists, advanced practice providers, radiological technicians, neurologists to take care of patients at this new site. Congratulations to all involved from Masonicare, Yale Medicine, Yale New Haven Hospital, and Yale New Haven Health. Now, it's my pleasure to introduce a special guest whom I've had the pleasure of just meeting all of 30 seconds ago today, the Mayor of Wallingford, William Dickinson Jr. Mayor.
We're delighted to join with you. Wallingford is proud to be the host community for 2 organizations coming together for a very special project, Masonicare and Yale New Haven Health. People need services, and health services are priorities. We're very happy to do what we can to see this as a wonderful success. Congratulations to everyone.
Thank you, Mayor Dickinson, and congratulations on your recent re-election as the Mayor of Wallingford.
Wonderful.
Now allow me to introduce John Paul Benoit, President and CEO of Masonicare.
Thank you very much.
It is nice to actually see you in person. Good afternoon, everyone, and welcome to the Masonicare campus. We're extremely excited to finally be celebrating a long-awaited opening of the Yale New Haven Health Orthopedic practice. Walking through here warms my heart in so many ways, knowing that you'll be taking care of many of our residents on our campus and many residents of the surrounding towns. It's just truly amazing. With the challenges of COVID derailing so many plans, we're thrilled to finally be here, together on this beautiful day, celebrating progress, partnerships, and opportunity. As we continue to serve our growing population of patients and residents, it is vitally important that we work with like-minded partners who are committed to excellence. We are thrilled to bring Yale New Haven Health to this campus and the town of Wallingford and surrounding communities, as we believe it will provide important access to world-class orthopedic services. In concert with the opening of the practice, Masonicare has expanded our own post-acute, post-surgical service line, including a new outpatient rehab gym located just around the corner in our Sturgis 2 building, and our new 19-bed short-term rehab center located on the 3rd floor of our Sturgis building. This state-of-the-art rehabilitation unit is complete with private rooms and baths designed for post-acute and post-surgical residents who need a short-term stay and a head start on rehabilitation before transforming home. The Yale New Haven Health practice, combined with our outpatient and short-term inpatient services, provide residents with a comprehensive one-stop shop to receive the care and services they need to return to their highest level of functioning. We are thrilled to have you on our campus and look forward to working with you as we serve the needs of our residents here at Masonicare and in our surrounding communities. I'd like to congratulate the entire team of the Yale New Haven Health staff. I'd like to congratulate the Masonicare staff. If I can I have you all raise your hand? And I would like to congratulate our board for being part of this. Our board chair, Robert Polito, is here, so thank you. And I know Rory Mikowski is here. But we are so excited for all of you to be here. Thank you and congratulations.
Thank you, John Paul. We are very proud of our partnership with Masonicare. It's been a pleasure to work with the members of your team for the past 2+ years. Now please welcome Dr. Irvin O. Dr. Irvin O. is the interim Vice Chair of Clinical Affairs for the Yale School of Medicine Department of Orthopedics. He is also our Chief of Foot and Ankle Surgery at Yale New Haven Hospital.
Good afternoon, everyone. It's great to be here at beautiful campus. And just good to see all the people that we used to see online and work together to bring this place into reality. I'm Irvin O, orthopedic surgeon. I'm here representing our department today, but starting 2 weeks I'll be seeing patient here. We'll take care of your foot and ankle issues if you have any, hopefully not. If you have any, just feel free to come to me. On behalf of our chair, Dr. Lisa Latanza, I'd like to thank our colleague at Yale New Haven Health for their collective effort in bringing this new place from concept to creation. We thank all your staff and also the Yale New Haven Health and our university staff for their incredible leadership and dedications. Especially, I'd like to acknowledge these people. If you just can raise your hand when I call your name. So Dr. Keith Churchill, thank you. He's the president of our Yale New Haven Hospital. He worked hard to help this out. And Mr. Michael Loftus, thank you for your He's our Senior Vice President of Operation, Executive Director of Neuroscience and Orthopedic Service. Brooke Spadacino, she worked really hard. She's the Director of Orthopedic Spine Services. She spent a lot of time. And Josh Forler, who's can you read? Yeah. Director of Administration for Spinal Musculoskeletal Care. Kathy Esposito. Is Kathy here? She's our Director of Operations for Orthopedics. And Margie Herbert. Margie, are you here?
Margie's not here.
Okay, she's a Regional Site Director who also worked hard. Marie Follow, thank you for your service. She's our Senior Director of Ambulatory Operations. And Melissa Triano, our Orthopedics Director of Internal Business and Clinical Operations. And many others who are here who really spend countless hours and effort to bring up this new facility so that we can see our patients here. Really appreciate it. So we are bringing 7 orthopedic specialists with 3 advanced practice providers to take care of all aspects of orthopedic needs here. Any musculoskeletal pain disorders we are ready to take care of. Any joint replacements, any major joint issues, shoulder, back pain, neck pain, you name it, we'll take care of it. The fact that we can bring orthopedics with other healthcare specialists in this one site is incredible. It's a tremendous benefit for long-term benefit of and well-being of this community. So we look forward to serve you, and we're going to provide the level of patient-centered care that Yale is well known for. Thank you very much.
So thank you to all of our speakers. You can hear the theme here: collaboration, partnership, shared values, and of course the patient at the center. In closing, I would like to acknowledge and thank a few members of the Wallingford project team who were instrumental in the construction, operations, and staffing here. Our key vendors who weathered the pandemic delays alongside of us: Slam Architects, Centec Engineering, Jensen Hughes, Ricci Construction, Johnson Controls, and Red Thread. The Masonicare facility manager, Joe Russo. Is Joe here?
No, he's not here.
Thank Joe for us. Our Yale Medicine colleagues, a lot have been thanked. In addition, Kelly Ainworth and Cynthia Bergman. Our Yale New Haven Health System colleagues, Jonathan Blanchard. You want to give a wave, Jonathan? John Campagna, Annette Kosha, Mary Inglace, Jennifer Lassie, Andrea Palenko. I know Andrea's back there. Diana Stango, who's the manager for the site, and Adam Tarfano. Please receive our appreciation for your efforts through all of these challenges, the typical ones and the unprecedented ones. We thank you all. In a minute, our speakers will head out the door with some special guests and will assemble to cut the ribbon. If you have not already done so, please feel free to tour the space here, and there are still shuttles that will take you up to the Sturgis building to see the new rehabilitation space. So again, thank you for joining us to celebrate this milestone, and please join us outside for the ribbon cutting.
1, 2, 3.